Thank you to those who have joined us so far. We'll just wait for a few more minutes and then we'll start in a bit. Thanks. Okay, so it has just hit 7:05, so I think we'll start now. So hello and welcome everyone. Thank you for spending part of the evening here with us tonight. So this is the second of our 4-part series of the Beyond COP online discussions brought to you by the Center for Sustainable Healthcare, and we're running adjacent to the 26th UN Climate Change Conference, also known as COP26, which is where Rita and Jacob are in Glasgow. I'm very happy to be chairing tonight's event titled Equip, Learning and Unlearning the Climate and Health Narratives, where we examine the healthcare system and questioning the narratives surrounding the environment, health and education. So the plan for tonight will be just a short introduction of who we are, and then we'll kick off with the main question addressing tonight's theme. We're also hoping to record the talk here tonight and upload it onto the CSH website and YouTube channel. So I hope that's okay with everyone. Our colleagues will also be monitoring the chat as well. So please feel free to ask any questions as and when they crop up. So I'll just kick off with introducing myself. So hi, I'm Pat. I'm a 4th year medical student at Anglia Ruskin University, and I'm currently on a year out working at the BMJ, looking after the content that BMJ student produces. I'm very passionate about planetary health and sustainable healthcare. I worked at the Met Office a few years ago as a summer intern, and just knowing the consequences of not doing anything about climate would be quite catastrophic. So I'm very excited to hear what discussions will be generated tonight regarding reimagining the narratives around climate and health. So without further ado, I'll pass my invisible mic to the rest of the panel. So in no specific order, just how it looks on my screen. Dr. Norrice, would you like to go first?
Hi, so my name is Norrice. I am a paediatrics registrar in London. So I have an interest in air pollution and how it can affect children's health. So my PhD was in looking at the effect of air pollution on children, specifically with cystic fibrosis, but I've also done some work on children with asthma as well. So I'm very passionate about having clean air for our children because I know how badly they can be affected. But obviously it's not just for children with respiratory illnesses, but it's also for everyone, isn't it? So that's me, and I'll pass it back off to, I don't know who's next.
Great, glad to have you with us. And yeah, Dr. Rita and Jacob, would you like to introduce yourselves?
Yeah, great. Hi, everybody. My name is Rita. I am a part-time GP and part-time researcher based in London. And I guess my journey with activism started as a medical student when there was the rise in tuition fees. And my university was one of the first ones to go into occupation. And the 6 weeks that we were in occupation was just such an awakening for me of breaking down a lot of the structures of how things were in my mind and really thinking like stuff should be done differently. And through that, I then got involved in lots of different forms of activism around the NHS, around climate and around migrant rights. And I guess my journey over the past few years or over the subsequent years has been exploring that in different forms, like through institutions, like I worked in the WHO's climate change department, through like extra institutional means, like I co-founded Doctors for Extinction Rebellion. I've just been on the Greenpeace boat, and I've been constantly trying to find the ways that are going to work in terms of influencing change and having impact. And yeah, so now I work part-time as a GP in a really amazing practice in East London that was the first to start social prescribing. We have a vegetable garden and a walking club and a choir and a resident artist. That's really, really cool. And then the other half of the week, I'm doing climate change, migration and health research at UCL, which feels like some sort of consolidation in a way of all the different strands that I'd been exploring for years when I had like no idea what they would look like together. And maybe they're starting to come together, but I'm still not really sure. I'm really looking forward to this evening. Yeah, I'll hand over to Jake.
So I'm Jacob, and I guess I'm here in the capacity. I mean, I probably identify as a clinician mostly. I've trained in psychiatry and mental health, and I think my interest in mental health is relevant in some extent because I think it shares quite a lot to do with sustainability insofar as that it's quite complicated and very much system-based, and there aren't really easy answers to a lot of the problems. And I think sustainability and the kind of challenges to health that we're talking about and the challenges to healthcare training share a lot with that. So that's, I think, part of the reason I got drawn into mental health. And from that, I ended up really having a kind of thirst for making a difference, I think, and making a change, because it felt like a lot of the sort of systems, the clinical practices which I was seeing were really quite stagnant, and that a lot of things that seemed obvious weren't happening. So I was working in a hospital where there's also green space, but it wasn't really being, a lot of the staff weren't being supported to use that green space for patients. And so I think I came into sustainability largely through that, where I was just like, well, why don't we get people outside? And it really came from a sense of wanting to have action. And I got involved with the Center for Sustainable Healthcare, and have been sort of trying to kind of stay involved with them and help out wherever I can. And then more recently, in the last year and a half, I've been working with the Royal College of Psychiatry and working with their Committee on Planetary Health and Sustainability as one of the registrars to basically promote sustainability and planetary health. And I think as well, seeing that as an opportunity to talk about social justice much more openly within the context of psychiatry as a profession, and being mindful of the opportunities that come from that. And equally, and just to say, I've known Rita, I'm very lucky to have known Rita since I came to London several years ago.
We did our first F1 jobs together.
We did our first job together, so we're also friends. But Rita has always been a huge inspiration in terms of being able to show to me and to other friends and peers that advocacy and health and being a clinician is very possible. And even hearing about
Thanks.
Norrice's, your work about thinking about air pollution and, whether academia is a way to do that or how you identify. And I think what I'm interested today is to talk about, what are the, looking at all the challenges coming ahead, is healthcare training up to scratch? Like, are we really giving, that those 7 years of paying tuition, are you really being given the tools you need to get out there and make a difference? I mean, my answer, I'll say right now, is no. But I think part of maybe this session is maybe to try to share some of my thinking about what are the things that to help students, because it's not happening from the top. And so maybe it's time for students to start making demands reflecting a lot of the kind of generational issues which are happening throughout the planetary health crisis. I'll stop talking, sorry.
That's great.
No, that was great. Thank you so much for joining us today. And wow, I mean, what a panel we have, ranging from primary care to secondary care and from academia to activism. So I guess without further ado, we'll address the main question for tonight, which is, what are the major approaches to addressing the climate crisis within healthcare and healthcare education systems that you think need to take place? Who would like to go first?
Maybe I can just kick off with, so we've not prepared anything, just to give you a heads up, and myself and Jake are both at COP, which is why we've got this background behind us. But I've actually recently written a paper which is going to be hopefully published next week, and we can share it with the group afterwards. And essentially what it's tried to do is this like ecosystem mapping of what the climate and health space looks like in England. And since 2015, the number of groups working on climate and health has gone from something like 15 to over 100. There's been like such an increase in the number of people who care about acting on the climate crisis using a health lens. And what we looked at was who are groups trying to influence and how are they trying to influence them? And generally what we've ended up finding is that a lot of groups within healthcare are very healthcare focused. So they'll be working within their like GP practice, their specialty, their hospital. And the methods are also like quite, I guess quite like institutional methods as well. It will be to like work incrementally to bring about like small changes within like your organization, which is all well and good, but it's curious that like across the range of organizations, the vast majority are doing that. And I think in part that arises because of medical training and because what we feel our scope of work is allowed to be and the way that we bring about change. Like medics by our nature aren't particularly radical, and we're pretty like by the book, and we just like follow the rules, and we like stick within our lanes, and we stick within our hierarchies and within our structures. And that is what's being replicated in the ways that we are collectively trying to bring about change. And maybe just actually one more brief thing on that, which is within like medical training, you have to do like so many audits. And so essentially what we found was there's just like lots of replication of very small projects happening like all around the country. But one of the benefits that we have of being in like a national healthcare service is that actually like these things could in some way be better coordinated, like be centralized through different organizations, like be happening on a much wider scale. And the question for me is like, why isn't that happening? Like, what can we do to better facilitate like working collectively and together? Because like on the whole, we're quite good at team working within hospitals. Like that is something that we are sort of trained for, but for some reason within this space, like we're not doing it that well. And it makes me feel like lots of people are doing lots of hard work, but we could be working less hard and be working smarter if we were to talk together a little bit better.
Yeah. Norrice,
Yeah,
did you want... Oh, sorry, go ahead.
No, I was just going to build on what Rita was saying. Yeah, I really echo what you said about there's so many people doing good work across the country, but they're not really talking together. But if we kind of group all the effort together, we can build on each other's ideas. Yeah, but sorry, Jacob, what were you going to say?
Well, I was going to just introduce, give the opportunity to Norrice to talk rather than me just jumping straight in, because it would seem almost too easy for me just to start talking.
Okay, I'll jump in quickly then. Just kind of building on what Rita was saying, there's so much truth in that, because I feel like we do a lot of things kind of within our little group, either like within our hospital, within the trust, but it's never like on a national level. And being both a clinician and an academic, I can definitely see like a huge difference between the two groups. So like in academia, lots of people are really well informed. In clinical environment, people don't really talk about climate change or air pollution because it's not something that like it doesn't feature, or it didn't feature much. And when I was in med school, I don't know about medical curriculum these days, but I just still don't think is a massive topic. I do get asked to do the occasional lectures for like second or third year medical students on air pollution, but it's definitely not something that happens regularly, so I don't think they get taught a lot. And even when we do teach them, it's not a big thing. So I think we're not that equipped as a group of healthcare workers to actually tackle the problem, either by raising awareness, because we're not actually thinking about it that much in the clinical environment, but also I don't know how equipped we are in answering questions in this area as well, because I do respiratory pediatrics, so obviously I see children with like cystic fibrosis and asthma and stuff, and those parents sometimes are more informed because they're more worried about, you know, their children's health and stuff. So you've got like a selection of group of people who are more kind of interested in the topic and would want to ask more, and I just don't know how well informed we are as a group to then be able to answer these questions or anxiety, or help them, you know, reduce their pollution exposure, you know, do anything about climate change. So I feel like I'm not actually offering any solution, but it's more just like the problems that I see on a day-to-day basis. I just feel that as a group we should be better equipped and better informed. That's the end of my ramble. I'll pass it back to you, Jacob.
No, I think it's not a ramble so much as, you know, the way that Kiana and Alex and CSH have kind of set this up is about a dialogue, because I don't think there are easy answers, but there's just so much to say, I think, on this point, because, you know, it's slightly tangential, but sometimes people will say that teachers know their students better than parents sometimes know their own children. And I guess the point that I'm getting at is that we spend so much time in a classroom, and if you're a medical student or a nursing student or whatever training background, you end up spending hours upon hours. And to think that you spend 6 to 7 years training, for example, as a medical doctor, I mean, that has a huge impact on how you think and how you relate to the world. And I think that this sort of really strange paradox where the way that Rita and Norrice have described, there's this kind of almost paralysis about creating change. And so we sort of satisfy ourselves with doing these small audits and these bits and pieces, but we don't feel like we're not empowered to make that change. And, you know, I think there's things that can be done, but the thing that makes me slightly apprehensive is that a lot of the time when you talk about training, the discussion goes to curriculum, right? Like, do we need to change the curriculum? And I'm not clearly I'm not pedagogically trained because I can't say the word, but, you know, there's something I'm like suspicious about this kind of promise of the curriculum that you can just add more questions to a test, bolt it on to have another sort of like study block. And I wonder if there's actually sort of systemic problems that need to be addressed in order to give people the best chance of getting, once they're done with those 6 or 7 years, and this gets back to my tangential point, I mean, that's a heck of a lot of time to be spending with people, and to not do right by that. And I mean, you know, as the UK, as in any country, getting into medical school is highly competitive. So you have to imagine these people are very competent in the first place. So what does it say about training that people who are presumably very competent are coming out of training experiences and they don't feel enabled to make change? And I would say, and I can say this with certainty from my experience, that even after 7 years of training in psychiatry, I'm like only beginning to think about this kind of stuff. So, you know, you think that you kind of like, you become an adult when you're finished with medical school, but actually you're just almost starting a different version of being in training. And so I think that the way that we think about training, for me, is a really important question, because the world is changing rapidly. I mean, like we're at COP right now, and I mean, it's just kind of, you know, if you let yourself feel it, I mean, things are just going to get from bad to worse, and a lot of that responsibility is going to fall on healthcare professionals. And the lack of emphasis on public health, the lack of emphasis on prevention, the lack of emphasis on understanding the way that morbidity comes about in healthcare training, and the sort of emphasis on acute interventions over and above like highly costly interventions. And it's not to say that those don't have their place, but it's not really a comprehensive educational experience, and it's not representative of the needs of what it means to be a highly important individual within a very changing and potentially very difficult environment, is what we're facing. So, you know, COVID happened and people are exhausted, and yet we're being asked as healthcare professionals to also take on planetary crisis. But healthcare training, for me, doesn't feel like I didn't feel equipped to come out of that to address these questions. I don't feel equipped to make differences and to make change quickly. And so these are like deep, complicated questions about systems, I think, and how we approach healthcare training. And how, you know, part of maybe what will come out of this discussion is maybe identifying some of the things that we would want to change, but also being suspicious of kind of the promise of maybe just changing the curriculum, because I don't know if that's the answer. I mean, one last thing that comes to mind is I think that a lot of what I would like to see is that, you know, healthcare students should feel more empowered to make demands and to ask questions. And if there's something to be equipped with, it's being reminded that, you know, I spoke to Professor Hugh Montgomery recently, and he was reminding, because I think sometimes people need to be reminded that if you're in healthcare, you're some of the most competent people about. You're very privileged in a way to have a lot of faculties available to you, and you could do many things, but you've chosen to do healthcare. So within that context, you know, are you being given the tools and the knowledge and the abilities to make change? And if not, why not? And if you're 18, 19, 20, 21, that's not too early to start asking questions. I mean, Greta Thunberg is so helpful in that capacity. She's just turned 18, but she within her kind of space has decided to say, look, I'm tired of waiting for people to change things. I'm going to change them myself. And I think that's very much about, I think if healthcare is going to bear climate change on its shoulders, I mean, healthcare training needs to change as well. You know, it's just not, we can't wait around, basically.
Yeah, I think just on that as well, just curious what you say about the curriculum, because I guess we're not only moving towards and are in currently planetary crisis, we're also moving towards completely changing the way that we deal with knowledge and information and data and tech. And actually, soon to be a good doctor, it won't be what you can retain in your mind. It's like how you access and use knowledge and information. And so like adding extra things to a curriculum like might not necessarily be the most valuable use of time, and instead like the ways in which we think and we work together and process information might end up being more important. And also I do want to recognize though that like medicine itself is like hugely heterogeneous, and I always say like I'm really glad to have done it because I've been able to really go like left field within medical training, but I've also had the privilege and the power and the respectability that comes with being a doctor that's also given me access to a lot of spaces, and I really recognize that. But for some people, like we are going to need deep specialists in like certain areas, that's true, but I would say that medical training generally like skews more towards creating that on the whole, rather than towards creating like the knowledge that like 50% of people are going to be GPs, or there's going to be like a huge range of the types of doctors that we're going to have. But the focus is very much on like how we're going to produce these like super specialized people, some of which we will continue to need because they will be like they will have like high technical skills, but actually a lot of that stuff is also going to phase out with like increased like robotics and like various other things. Like training is changing, and the medical field is changing, and it maybe feels like the issue is that the people who run medical training are like still within a certain time, and it hasn't quite updated to that. This is just my projection though, because I've not been in like a medical school lecture theatre for a very long time. So maybe you're all learning about like, I don't know, like machine learning and and healthcare. I just also wanted to say one brief thing that I thought about. So when I joined the UCL occupation, this was in like 2010, and it was such an exciting time. There was lots of people who came in and gave lectures, and I felt like within those 6 weeks I'd learned more than I'd really learned in like my 3 years of medical school up until that point. And then I remember there was like one day where we all went this like squat, and I ended up building a kitchen with somebody out of, there was some like Argos catalogs. It was like such a random day, and it was a day where I was actually meant to be on like a GP placement, and I went and did this thing instead. And at the end of that day, I was like, this was worth it, because it has given me just like such a different experience and such a different way of like seeing how things could be done. And so if we're not getting all of that training from within our institutions, it's like, where can we look to outside of our institutions to learn those things? Because I feel like we probably have all the knowledge that we already need to know. What we need to be doing more of is like cross-pollinating across like disciplines, ways of thinking, ways of doing things. And that's where like the frontiers are going to be created, and like where stuff is going to emerge.
Yeah, I think you've touched on really great points there. I mean, with the medical education, I think a lot of the things that we're doing are like tick boxing exercises, as you said, like doing audits, I don't know, getting things signed off. And I can assure you, we're not learning machine learning in medical school. We're still learning how to use a bleep. So yeah, as you said, there's still a lot of things that need to be changed. And as you said, I think there's a lot of experience that we can obtain outside of our medical curriculum to better equip ourselves. So what are some, where can our current medical students look for these experiences to better equip ourselves for the future, especially when you said the, in terms of the climate crisis as well?
I guess there are loads of things you can do on an individual level. So if you are just wanting to learn more about climate change and air pollution, there are loads of resources, even from like really basic things. So you've got like websites from things like, British Lung Foundation, or even just the government like DEFRA website that will tell you all you need to know about air pollution and climate change. WHO has really good information as well, and these are designed for lay people, so they're like really easy to read. And then if you're really interested, you can obviously then read more academic kind of journal papers. But also in terms of like being a part of something, there are loads of campaigns that medical students can join. So I'm a member of a campaign called Doctors Against Diesel, which is part of MedAct. So my research supervisor co-founded this campaign, and I know it says it's called Doctors Against Diesel, but it's not just for doctors. So it's like healthcare professionals, nurses, scientists, anyone, or even lay people like non-healthcare workers. Basically just a group of people advocating for clean air. And we do things like campaigning, writing letters when it comes to things like, ultra low emission zone, or wanting better air for like, streets around schools, promoting like cleaner air for children and things like that. So if you want to be a part of that, these are the things that you can do, and you can join things like, Greenpeace or Clean Earth, MedAct, like I said. All of these are Doctors Against Diesel. I just saw the thing that popped up, diesel as in like the fuel, like petrol versus diesel. So these are the things that you can do like on an individual basis. Obviously then you can join other groups as well. Don't know if you guys want to add more.
Yeah, I say this with like a tiny bit of hesitancy, because I recognize that like this takes energy and time, and like often when you have exams and things like that, like it's going to, there's like the stuff that you need to do just to like feel like you're keeping afloat, and then there's like all the stuff that happens in the extra band, like but something that I think it's just like having a curiosity and a care for the things that are going on around you, because essentially like everything can be seen through like a medical or a public health lens, and every like community project, campaign, like whatever, would love to have like a health person to be able to bring that angle, because that's something that really resonates with like the general public. It's something that people like really recognize as like vitally important. So like, yeah, even going along to like, I don't know, like a school like PTA meeting and then being like, oh, have you noticed that like kids around here have asthma or something? And then you can like talk about the air pollution aspects of it. Like that is just like one small thing. Or like your like homeless, you know, there's going to be lots of different stuff, like just like having curiosity. Like there is always going to be a way of like seeing it and learning experientially rather than like necessarily having it like taught to you. Yeah, and also reading on that note.
It makes me think a bit about I'm trying to just think through why because what's being offered now is alternatives outside of medical education, and maybe it's too much to say that for me, I feel like we need to be one of the things that I think needs to be equipped is that medical students or healthcare students and nurses and AHPs need to start understanding how much power you have, in a sense, that you're coming into the profession hugely capable already. And yes, as Rita rightly so, she cautioned about looking and finding for things and filling up your time and doing things outside of exams, etc. But I think that there's something about the way we're trained that you forget about your position in society. And so I think you can reach out, and people will be really interested when you do reach out. And if you reach out when you're in training, or if you're as a doctor, or when you're qualified, if you're in healthcare, that means a lot to the space that's outside of healthcare training, if that makes sense. So if something can be, if part of the session of equipping, I think I would really want people to walk away with the sense of like, you actually have a lot within you, but there's something, maybe the word is high, there's something about the hierarchy of healthcare training and healthcare generally, which is necessary because you need teachers to teach you things because you don't know. But I think there's also a kind of humility about like, well, what do I know, what I don't know. But what I will say is when I've spoken to medical students, particularly, they know so much more than I did when I was 22 or 21. And so you know so much more than you think you know. And I think it's really important to sort of have a bit of faith in that, but also to work within yourselves. So in terms of, to answer your question more directly, Pat, I would say that, find the group of people in your cohort that have the same ideas, and then just make something together, and then just think about what you guys want to do, right? Rita and I talked about this, I don't know, 2 years ago, but this kind of emphasis on community. Find your community, whether it's within your cohort or outside of training, and then just build something within that. And if it's something that interests you, just have faith that it will go somewhere. But I think that really starts with it. You have to have some sense of self-assurance about that. And I think healthcare trainees will have that in droves, because to even get to that stage, you're already very capable.
Yeah, thank you for that. Yeah, I think especially with young medical students, I think sometimes we're so used to just shutting the curtains behind doctors or like describing. We don't realize what power we can have to really empower a voice. People like Michaela Loach, who's a medical student at Edinburgh, and she's like speaking at COP right now. So I think collectively, as a group of young people, we can make change happen. And we've just got a question in the Q&A box here. They're quite interested in the work that you're doing, and they're asking, how have you found being able to balance clinical work and your passion for climate action?
Norrice, do you want to go for that? You've been trudging through a PhD.
So I guess I kind of cheated a bit in that sense, because I wasn't doing clinical work when I was doing my PhD. So that's usually how we do high degrees in medicine. So I guess you could, if you're interested in academia, you could start off by being an academic clinical fellow, where you, like, at the beginning of your training. So you can, I think you can do that in foundation year as well, but definitely as an SHO in pediatrics anyway. And that'll give you kind of 50-50 clinical and academic time in one of the years. So you get like at least 6 to 9 months of academic research time where you don't have to do any clinical stuff, so you can focus. And then if you want to do what I did, which is to take 3 or 4 years out of training, and so you just put your training on hold and just go and do a clinical or scientific PhD, then that's what you do. So now I'm back in clinical training, but I'm still doing academic work, which is hard. But I think if you're really passionate about something, you'll just make it happen. But there are sacrifices, like, you know, having to do academic stuff when your day's off, like today. That's what I've been doing today. But it is doable. And then in higher training, obviously, you can then also become an academic trainee, and then you get 50-50 as well of clinical and academic time. It is hard work to like juggle the two, especially if your clinical rota is a bit painful, which we know some hospitals are quite difficult to get any time off, or not feeling dead on the days that you're off. But it is doable. Don't know if that really answered the question.
Yeah, I guess maybe similarly to that, like actually during F1 and F2, I didn't really manage to do very much. I think I was doing some like BMA, like divestment stuff, but it was very like minute amounts of work. And then I ended up taking out 2 years after F2, and then had like much more flexibility and time to like explore various things and do like internships and travel and like, yeah, and really like deepen some of my interests, I guess, within that. I'd applied for an academic foundation and like didn't get shortlisted for it. And then I ended up doing an academic GP placement. So also don't be disheartened if like you apply for academic things and you don't, yeah, that doesn't happen, because there's always like other opportunities at different points. And so like Norrice said, actually my last 2 years of GP training, half the week was GP and then the other half of the week was doing academic stuff, but I was able to sort of like swing it so that I could also do a lot of activism during that time and things like that. It is challenging to maintain a full-time clinical job and also be like delivering on other things. Clinical work is really exhausting and tiring, and also like we need to look after ourselves and look after each other. Maybe one final thing on that is like, I guess I feel quite lucky. A lot of my friends are really into this stuff as well. And so actually it's sort of like we hang out and we do it at the same time. So it just sort of encroaches into my social life as well. Yeah, like us two being here.
So I will look to answer a bit of your question, Shiwei. Yeah, I think it's really important to think about, and I think one thing that comes to mind off the back of what Rita said was that this idea of taking time out, again, in terms of equipping people and reminding you of the kind of power and capacity you have. You are highly in demand as a healthcare professional, especially in the NHS. There's so much need for you to get back in and to do work. That means that you have a bit of leverage in terms of making demands. And I think a thing that you don't get, I think probably this is done semi-intentionally, but in healthcare training, I think that you're kind of taught to not make demands of the system. And I think taking time out, everybody I know who has taken time out in some capacity to follow their passion or their interest has done well by it. And so if you find a kind of tangent that interests you, you know, and you can kind of justify it to yourself, then I would say definitely follow it. Specifically for me, I think, you know, as a specialty of psychiatry, I'm very lucky because particularly within the trust that I've been working in, I would have a special interest day. So that's one clinical day that my trust would pay for me to do what I felt would be kind of contributing to my training. And that happened to be the space of sustainability. And so I think for me, certain clinical pathways would make it easier. I imagine that within I think particularly speaking of thinking of friends who've been through surgical pathways, there's just such a high demand on, and I'm not saying that you shouldn't, but because equally I've met surgeons, for example, an orthopedic surgeon who is doing his entire focus and work around sustainable orthopedic practice. But I think different specialties have different cultures. And I think that's something to be mindful of as well. But I think, again, to sort of end on the point that Rita said, that, you know, I mean, burnout is something that's very real. And, but again, at the same time, like, I've actually kind of paradoxically found that doing sustainability work infuses my clinical work almost. And so, yes, I am doing more. And if I just did my clinical work, I would be doing less. But I actually find a lot of the meaning and satisfaction within working in this space, and that they end up actually feeding into each other. And so, yes, like the quantity X of work is larger, but it somehow all feels more possible. And it'd be nice to be able to just do the one thing, but I'm very happy for the compromise that I have.
Yeah, definitely. And I guess going back to our main question, maybe a change that needs to happen in our healthcare education system is to make taking time out easier. And when you're going back in, it's easier to go back in as well without ticking all those boxes or revalidate, etc. And I guess going back to what we can do as medical students now, you know, there are a lot of things about, you can talk to your patients about the inhalers or talking about anesthetic gases. And I guess in your respective specialties, are there any things that medical students can learn or do that has some kind of climate factor in it that they can implement in their future practice? Maybe, like, for example, I work as a clinical coder at a GP, and so I read letters between secondary care and GP. And basically one of the letters I read during the summer, last summer, so it was boiling hot, right? And then one of the nephrologists said that, oh, you may want to reduce your diuretics because it's really hot and you don't need to have that much diuretic as your normal dose because you'll be sweating, for example. So I'm just wondering if you have any examples for our medical students to take away from tonight.
Sorry.
Should I go? Do you want to go?
Yeah,
Norrice?
go for it.
I don't have any practical advice specifically. I mean, the practical advice would be to think about things like social prescribing as an alternative to a lot of standard prescribing practice, not as an alternative, but possibly more to complement, and to think about environmental solutions to promoting health. And so I think something I'm very fond of is this concept of salutogenesis, which is health promoting environment. So healthcare is very pathogenic focus. So what makes people sick? And I think we need to be thinking more about what keeps people well. So you go through training and you read about pathology and pathogenesis, but we should be thinking much more about what keeps people well. And that kind of feeds into my other point about, I think if you're not finding that's the case in wherever you're getting trained, I think that getting a public health cap on and thinking about public health is really, really helpful, because the patients that you're going to come and see, you know, whether it's any non-communicable disease, whether it's mental health or diabetes or hypertension, a lot of those solutions are actually lifestyle focused, and a lot of them are systemically based. And so I think even just recognizing that and helping the patient understand that because they're below the poverty line or because they don't have access to good food, I mean, even helping explain that kind of education goes a huge long distance, because otherwise people are kind of left in the lurch thinking that they're sick because they made bad choices. But actually there's real systemic problems that they don't necessarily have control over. And so I think as a student, you'll have an opportunity to kind of use that public health lens and explain to people that, yes, I mean, you make your choices, but there's actually lots of systemic factors at play that you don't have control over that are contributing to your ill health. And yeah, taking statins and taking insulin will help temporarily, but those solutions are very much lifestyle focused. However, oftentimes those solutions are very hard to change because they're based in systemic inequalities. So I think that knowledge and sharing that knowledge with patients is really, really important and very powerful.
I guess traditionally when we're taught to take history and stuff from patients in terms of respiratory stuff, we always ask about smoking and drinking, like, you know, I don't even know how you calculate pack years anymore, because obviously kids don't actually smoke, but you're trained to do this, and you're trained to ask about pets and carpets and things like that. But I guess one new additional thing that could be quite helpful in this day and age is ask about pollution exposures. Obviously the child or the parent's not going to know how much pollution they're exposed to, but what you can ask is things like, you know, do they live on a really busy road? Is it like, are they right next to a dual carriageway, or, you know, is the school playground surrounded by motorways? And these are the things that not necessarily going to help you in the short term when you're taking the history or offering your treatment or giving your subusual nabs or whatever you're doing in an acute setting. But it's something that will be helpful for you to think about. Is this one of the triggers for the child having asthma attack or, you know, CF exacerbation? If that seems to be a trigger, then you are able to offer help and advice as to what they can do. So not just, you know, you can refer them to different kind of websites, like the British Lung Foundation website gives you lots of tips on what you do on pollution heavy days. You can then advise them on, you know, doing things like driving less, so you're contributing less to climate change and air pollution, carpooling, walking on quieter streets, taking a slightly more scenic, maybe longer route to school, things like that. So that could, in the long run, make a difference. So I guess that's something to think about in your day-to-day practice. It's not just regurgitating what we learn off by heart when we take history, but also actually thinking what's actually happening from a pathology kind of way, or a more molecular kind of way when you're trying to make a diagnosis. So I think that'll be quite interesting as well for you to think as you see a patient.
Yeah, I completely agree. I've also shared a blog which some friends wrote, which is how to speak to your patients about the climate emergency. I'm a tiny bit controversial in my views around this, which is that, so for example, coming to Glasgow, it costs like £50 to get a flight and like £150 to get the train, or like you go to the supermarket and everything is covered in plastic, or it's like, yeah, cheaper to drive than it is to get the train. Like, you know, there's like lots of systemic reasons that mean that people will make decisions based on like ease and finances rather than stuff that's going to be like climate friendly. And like often actually people don't have that many alternative options. Like it's too much to ask like my population who like live in East London in like one of the highest like rates of poverty in London to make those changes themselves. So like I sort of feel like as an advocate for my patients, like I actually don't fully expect them to be the ones to make decisions that are more expensive for them. Like how can I bring about the changes so that those things are just going to be like the automatic options of what they can choose. However, there is like one strong exception that I feel to that, which is around the issue of like health co-benefits, which is where things are good for health and also good for the planet. So for example, like, yeah, doing a sort of joint up like walking school bus type thing, or yeah, cycling or spending more time in nature, or like growing some veg in our community garden or whatever else, like that is going to be good for their health and well-being, and also like good for their pocket and good for the environment. So finding those things that they can try, and they will also see the direct benefit to them. It doesn't feel like a sacrifice.
Yeah, that's such a good important point, that we know that climate change compounds social inequalities, and not all eco-friendly actions are accessible to patients. So it's really important to kind of translate whatever that patients can do in terms of eco-friendly actions. And as you said there, plane tickets are more expensive than train tickets, which doesn't make sense when, you know, we're trying to go towards a more green future. So I guess that brings us to, you know, legislation and activism. And so a lot of, you know, young people now are involved in activism, but you know, but not that many like healthcare students are involved in healthcare legislation. So what do you think why this could be?
I mean, my first, again, I think this goes back to training. I think that we're not exposed to particular role models. I mean, I know within psychiatry, people like Frantz Fanon is a psychiatrist who did a lot in terms of representing the kind of the pains of decolonization, and was basically able to marry a clinical career and then transform that into considerable activism. So I think it's about what are the kind of figures that we're exposed to in training. But they're, you know, I mean, with psychiatry has a different, has a history of having people which do push certain boundaries, because it's such a, it has its sort of complexities. And I think it sort of sits somewhere between society and how health gets constructed in a kind of interesting way. But I think in terms of trying to get healthcare students to appreciate, again, how they can be empowered and to become more activist focused, I think part of the solution is about introducing more figures that can be seen as such. I mean, Rita would have met a lot of them through her time, I think, with the WHO and MSF. But I mean, MSF is an organization I've worked with briefly as well, and that's a hugely inspiring group of people who I think fundamentally probably see their clinical work as fundamentally activist. And that's a very different way of looking at things, as opposed to, I think, service provision. You know, I think like you come out of training and you're like, okay, I'm going to do my job. But I think I mean, you'll be able to speak to this better than I can, but I think that clinical work can be fundamentally activist in of itself if you see it through an inequality lens. So that's kind of an initial answer.
Yeah, I guess to me, like the parts of the equation that make up.
Oh, sorry.
Lost our headphone. The parts of the equation that make up for me, like what makes me an activist or what makes people around me activists, is like firstly recognizing that there's like some sort of injustice, and then feeling like you have the like capacity, the right, the space to like try and do something about it. And often I think like we get stuck in like with one and like my family who are inactive, there's the stuff that's wrong. It's just they don't feel like they have the right or the power to do anything about it. And working out what that looks like is really, really challenging, actually. It's not easy, because if it was easy, then we would have solved all of our problems and all of our crises. So I think that, yeah, maybe part of that for me is like finding community and like ways of like bolstering and like bigging yourself up, and then also not necessarily needing to copy other people, like just working out what works for you. And like so many times during my career, people have said to me, like, when are you going to settle that? Like, when are you going to decide what you're doing? Like, instead of converging, you keep just diverging and doing like all these random things. Like, how is that job related to that job? Or like, how is that experience related to that experience? Or like being an activist and that related to being an activist? But I sort of see that like all of it is just like building and bringing skills and like trusting in the process. And there's like, as long as every, I guess, like decision and way that you're acting is in alignment with some sort of values, and you also like step into what you know is like your power as a medical student in the UK, which is like a very, or a healthcare student of any sort. Yeah, bringing those two things together, I feel like the only inevitable outcome is a form of activism, and it's going to look different for everybody, because you'll just find what your skills are and like what note you resonate on.
And I would just add to that is also, it's worth knowing your history as well. I mean, if you speak to consultants who are probably retiring at this point, it was standard to do a whole mix bag of different clinical experiences before you chose what you wanted to do. So there's a lot of pressure for people to just choose something now and then commit to it. But I think Rita's experience about looking and trying things out, that was much more what was the standard way of doing things for a long time. And there's a lot to be said about that, but there's a lot of pressure now for people to hyper specialize, to choose early, to commit to a path. But again, I think that goes back to your second point about feeling that you have the ability to make a choice. And so I think that very much comes from starting, like, you know, within yourself. But I think knowing history, knowing what's happened before and other ways of seeing and doing things is really, really helpful.
I guess also how big an activist you are also depends on your personality. So some people are just naturally more outgoing and more determined more confident to go and speak about things or talk to a big audience about things, or go as far as going on the news or the newspaper and things like that. But some people are just naturally more timid, and that's okay as well. Like, you don't have to be on the news to make a difference. I think I strongly believe in every little helps, like genuinely in that sense, because I feel like even if you're just talking to one parent or one child or one patient with COPD about, you know, just switching to an electrical car, or just walking on a quieter road, or just one thing that they do. And if you talk to enough people in a bigger group, you will make a difference. So even just like, you know, me doing my research, which was obviously based on air pollution, I had to like go and recruit all these children who are healthy and a group with cystic fibrosis. And most of them weren't actually that, you know, into air pollution, because they don't really think that climate change or air pollution is really that big a deal to them, because, you know, to them, you know, football matches is more important, or like GCSE is more important, or you know, actually getting a cold that triggers their asthma is more important. You can't see pollution, you can't feel it, and you don't always feel the effects of it, especially if you're healthy. So even just me approaching them and saying, this is a project I'm doing, are you interested? That kind of like just sparked their interest. And then loads of children and loads of parents then became really interested, and they were really engaging, and, you know, they were really excited to, you know, see the results. And then some kids, because I did like pollution monitoring as well, and some kids looked at their pollution graph and realized that, you know, whenever they go out to the playground, their pollution level shot up, and they were really shocked, and they would take it, you know, to their teachers, to their school teacher, to say, you need to do something about it, we need to build a hedge. And, you know, like even just small things like that, you can make a huge difference. So don't feel the need that you need to be on national news or campaigning all the time. You can make a difference even just by speaking to patients. Just like how I would, you know, when I talk to children with asthma, ask them about inhaler technique, and I always ask them if they know what to do with their spacer, if they know how to clean it. And it's just something I throw in, and you can do the same with like any topic, with like vaccinations, pollution, climate change. You know, you can make a huge difference. That's just what you need to know and believe in.
I would just that's so well said, Norrice. And I just wanted to add to that I think another thing that maybe to equip with is just having a more open mind to what activism means, and that clinical work fundamentally is activist in a very real way, because you're helping people and you're making changes. So however you come to it, I think just have an open mind and allow yourself to think about yourself as an activist. And however, if you're more extroverted or introverted or academic, or however you find it, I think, we're very lucky to be all in a space of healthcare, which means that I think activism is a word which we can, I think, feel quite comfortable using for ourselves. And what you do, as Norrice exactly pointed out, is very much personality led, but allow yourself to access the kind of satisfaction that comes from knowing that you're doing something that's activist based.
Yeah, maybe just on that very small point. If you want to read about a really cool person, I'd look up a woman called Mae Jemison, M-A-E.
Can we share that?
Yeah, Mae Jemison. So she was the first Black woman to go to space. She is like an engineer, dancer, doctor, works for the Peace Corps, children's book writer, Star Trek actress. Like, she's literally done like absolutely everything. She's so bonkers. But when I randomly came across her, what she says is really nice, is that firstly, she's like, don't let yourself be limited by other people's limited imaginations, which I think is like so great. But then also I went through, I think it was like actually just after my F2, I started reading about lots of people that I was really inspired by and who I felt like had made a real difference in the world, because I was like obsessed with impacts, and it's like, what is going to actually have impact? And then it actually turns out that like there's no formula, there's no one size fits all. People just like, probably at the point that they were going through on their trajectory, they had no idea like where it was going to come to. They were just doing what felt right for them and doing it in their own way, and responding to the world around them, and like being like reflective and observers, and like finding ways of, yeah, of like intervening in whatever small sphere of like influence that they had. So I found that like a little bit reassuring, which is just like, I don't need to know where I'm going. Like I don't need to have like an aim of like, I want that job or whatever. It's just, it will like come and like cohese like some way. Yeah, and that I guess that to me is like the activism that I'm following at the moment.
Yeah, that's really empowering. I think it's good to know that, as Norrice has said, it doesn't matter what form or what scale it is, like every little helps. So I think I'm gonna bear that in mind when I next go onto award. That'll be next year. So as we're just close to the end of this webinar, are there any like take-home messages that you like our participants here today to take home with them?
I guess maybe just a little bit about clinical and academic work. When I was at your stage, so when I was a medical student or like a very junior trainee, I really like, I was obsessed with like getting into training and finishing training. Like I was obsessed with the idea that I just need to get it done. I'll be full-time the whole time and I'll just get it done. I'll be a consultant at the age of like 34 and it'll be done. That obviously didn't happen. and there's no rush. There's no rush in doing that, because you will spend the rest of your life being a consultant in what you want to do. And there's absolutely no harm in taking some time out and doing something that you're passionate about, and that will change your career and life course. And I have zero regret in taking time out to do academic work. So if that's something you want to do, I would definitely encourage that. It's not really related to what we're talking about, a bit of life advice.
I feel like I said my like final thing with my love of Mae Jemison and just like following your own path. Although it's, I mean, I do admit it's very tricky, especially like, yeah, medicine is very mainstream. A lot of us will come with like parental expectations, like family expectations, like ideas of like how our lives should look, and doing something different to that can be challenging. But yeah, I guess like trust, finding your people, remembering to like resource yourself and to drink water on long shifts. Yeah, sorry, I don't have anything more than that to say.
No, I mean, I think I would just build off that. I think if you have a vision of what you want to be doing, and it feels like healthcare is a space for it, then just really push out to the boundaries and explore that. And I think this gets back to kind of what we were talking about at the beginning, that again, the 21st century and the centuries to come are going to need a very different type of healthcare professional. And it doesn't seem like training is caught up with trying to equip people to no one really knows what that's going to look like. I mean, I have some sense that it's going to be very different. But I think that if there's some uncertainty, it probably reflects the fact that no one quite knows what's the kind of demands that are going to be asked of people working in healthcare. So if you have an intuition, I would, as Rita and Norrice have been saying, I would absolutely follow it, and come up with something. I mean, just to kind of put things into perspective, anytime I've been at COP or even before COP, if I say I'm in psychiatry and I'm doing sustainability, there would just be kind of like, kind of eye rolls. You're just like, okay, so like explain to me why this is even connected. But it's like very obvious to me and very obvious to the people in my community that care about this issue. But if you see something clearly, then it must exist in some capacity, and then other people will start seeing it if you follow that path. So mental health and like mental health and climate, people are talking about eco-anxiety a lot more now, and it's sort of like these things are just being spoken about in much more common, in like, here, even at COP. it becomes an interesting talking point because people are saying like, well, mental health and climate change, like I've never even heard of this. And it's shocking because it's like, well, if your house gets flooded and you lose your home to a forest fire, how could you expect to not have that affect your emotions and thoughts? And how could that not be a generational problem? So I think healthcare is a really rich space to explore your identity and what you think is meaningful. And unfortunately, for better and for worse, you know, the adults in the room don't have all the answers. And so it's very much for people coming up to see what makes the most sense to them and just to follow that and just basically carve out something totally new because we need it, basically.
Yeah, definitely. I think in healthcare, we're in such a privileged position where we can propose change, make change, and relay the changes to future generation. And as you have demonstrated here, also being a role model for people to follow and make changes themselves. So I guess we don't have any more questions. So I guess I'd like to thank you to you three for being here tonight and inspiring us. And to our participants, it would be great if you could spend just like a few minutes to fill in the feedback form. That would be very great. And for our next session next week, it will be about mobilizing, transforming health structures through action. So if you're interested to sign up for that, that'll be next week. So yeah, that's it from me. So thank you again.
Thank you.
Okay, bye.